The top part of the board, right? Okay, it's April 7, 2022, and we're streaming live from Deuk Spine Institute, Surgery Center, Vieira. Our next patient is here with two herniated discs, one at T8-T9, the other at T12-L1. And we're going to get started in just a moment. Are you comfortable? All right. So I'm going to give him a little bit of numbing medicine. A little numbing medicine, all right? That's normal.
Just giving you a little shot, Chase.
Yeah, giving you a little numbing medicine. Do we want to try, Dr. Berndes, to do a little lidocaine in the irrigation, or maybe not for this one? No, I'm just thinking out loud. Maybe not for this one, because it's thoracic and the spinal cord and everything.
What about this idea? When you have the trocar down, before you place the endoscope, maybe put a 1 cc or a half a cc. Before you place the endoscope.
We could try both. All right, so
Okay, buddy.
T12.
So listen, Chase, we're going to start right now. I got to have you a little bit awake for this. Remember we talked? Dr. Deuk's going to create a little bit of a roadmap on your disc here to try to find out what's going on, all right?
Shot.
I'm right here, bud.
All right, let's go lateral. You're doing great.
Doing great.
Num num.
Leave your sides.
Yeah. I did it. I need a new glove. Outer. And inner.
Do you want some alcohol dumped, or you want
Yeah, a little alcohol. Thank you.
I have it, yeah.
Okay, so is that okay for you? Sure.
Hmm.
Just let me know what you think.
Good, or do you need to?
No, just thinking about the laser. Should be all right since we're under the glove. Yeah, yeah, it's fine. It's on the ground, right?
Yeah,
Right. I need a stylet. Why do we have so many needles?
One for each, well, you can use one or two, and this one is just for irrigation.
But these are expensive. Let's not open them any more than we need to. All right. Is that where we are? All right, so that looks pretty good. We're going to have to make our way down there. This is, again, T12-L1. Everyone agrees? T12-L1 is what we want. Shot? All right, so I'm going to hit the posterior elements, and I'm going to go anterior shot. And before I go too far, I want to make sure I'm in the right spot. Shot? So I'm going to stop there, and we're going to get an AP. A good way to count is from the AP. You want to look at the last vertebrae with a rib. So that would be T12, and then we'll go down below that at a 1. There's T12 with a rib, and then there's L1. So we're at the right disc. Let's just go to a lateral and verify that with a lateral view. Thanks, Luis. I want to see the sacrum. I want to make sure that's indeed T12-L1. A zoomed out view. That's fine. All right, so you guys okay over there? All right, so 5, 4, 3, 2. It's kind of hard. We really can't see it. I need the table up just about an inch or fluoro down. Good? Shot. All right. Let's move the fluoro north a little bit. Shot. All right. So there's 5, 4, 3, 2, 1. Still don't see the needle. Let's keep the fluoro on in cine mode and go north. On, cine, move north. Stop. All right. Good. So 5, 4, 3, 2, 1, 12. Everybody agree? 12, 1. So we're at the right level. Let's go back up north to the 12, 1 and we'll proceed with a lateral view. All right. Table down. Table down just a little bit for me. All right, good. That's good. All right, shot. All right, so I think we're off on orbit a little bit. You can see we're about 2 degrees off on orbit. Shot. Shot. Table's fine. What do you think there, Jordan? It's not bad, but I can't really tell. Let's see. What do you think? Is that worse or better?
I think that looks a little worse.
Try going the other way. Let's see. So we're adjusting our fluoro relative to the patient's spine. I think that's better. That looks good. I think we're good. You comfy? All right, you're doing great. Just lay still. Shot. Continue to lay still, and we're going to be done very soon. All right? Shot. Shot. So I got to navigate through the foramen right here at T12-L1. Shot. That looks pretty good. Shot. I want to aim up towards the disc. Shot. Yeah, there's definitely... where do you feel that? In your back. Shot. So I think we could wag it a little bit because I think we're off just a little bit on the wag. Shot. That's worse. All right, that's pretty good. Let's you okay? Let's get an AP. See where we are. Should be close to the back of that disc. Then we'll do one more. Yeah, the AP will help us localize as well to make sure we're at 12-1. Not bad. So we should be right where the disc is. Okay, good. That's definitely 12-1. The way we know that's T12 at the top is the rib attaches to the pedicle of 12. This is a beautiful spine. Okay. Just probably need to be a little bit more north. Shot. Where do you feel that? Your back?
Right there at the needle.
Try not to move. All right. Need to approach a little bit higher. Shot. I'm going to pull back. And I'm going to shot. Shot. That's better. Same thing. Kind of feel the herniation there. Shot. Right in your back, correct? Yeah, that's your first bad disc. We're going to be fixing, okay?
Fix that disc.
Huh?
Yeah, tell him to fix that.
We're going to fix that.
He said sounds good.
Yeah, that's the T12-L1. You okay? All right, good. But I got a really good trajectory. I got a good lateral to medial approach, so it's going to be good. All right, so kind of halfway done. I got to get the other one now, all right? So hang in there. So the good thing about doing 12-1 is we know that's a 12-1 disc, right? So we could use the needle as a marker now. So 12, 11, 10, 9, 8, 8, 9 right there. You see it? 8, 9. Everybody agree? I'm going to have there. So the needle's at 12-1. So that's 12, 11, 10, 9, 8, 8, 9. Are you all right? Comfortable? As comfortable as you can get, right? Being in surgery? Shot? So 12, 11, 10, 9, 8. That's pretty good, Jordan. I mean, we'll be able to see it soon. Shot? All right, very good. 12, 11, 10, 9, 8. 9, 8. Perfect. Let's just do a quick AP view and see what we've got AP, and then we'll come back to that lateral. I just want to also be able to count up from the ribs to make sure we're going the right way. Yeah, it's very nice, very nice, very nice. Beautiful. All right, yeah, 12, 11, 10, 9, 8. Everyone agree, 9, 8, 8, 9? And that's what we're doing, both from the left side. Okay, nice job, Luis, marking out. All right. I'm going to need to see, I'm going to need to see posterior a little more. Very good. 12, 11, 10, 9, 8. So I'll do a lot of counting during surgery. I'll count like 20 times because I want to be 100% sure about where we are. Shot. So now I'm interacting with the posterior elements. Shot. What do you feel? Shot. Perfect. Shot. Shot. How's your breathing? Shot. Yeah. Shot. So AP. Beautiful so far. So the big risk with this type of surgery is a pneumothorax. And that's why I asked you. Yeah. Yeah. Anyway, we're pretty much clear of the lung field now. And I mean, it's as perfect as it gets. Incredible, huh? Huh? It's perfect. Doesn't get any better than that. We're very fortunate. Everything is going really good right now for you, okay? So we're going to put you to sleep soon. And look at that. Across to the midline we got with that other needle at T12-L1. It's like amazing. All right. You comfy? All right. We're going to put you to sleep shortly, but I just need you awake just a little bit longer. Shot? Huh?
Sounds good, he said.
Is that where you get your pain? Shot? Yeah, that's your other disc. Is that where you typically get your pain?
Yes, sir.
Yeah, how did you find us anyway?
I found it on YouTube about 2 years ago.
Wow, found us on YouTube 2 years ago. And you knew we were doing thoracic stuff back then?
Yeah.
You must have watched like my first one.
I didn't think much of it. About a year ago, I said, no, I need to go here.
Yeah, you're right. I'm the only person in the world doing thoracic discs, transforaminal like this, outpatient, minimally invasive. No one else would ever operate on you. I can pretty much guarantee you that.
Yeah, I realized that pretty quickly.
Yeah, the spine surgeon, the thoracic spine is like no man's land. Nobody wants to go there. It's so dangerous.
Yeah.
But when I thought of this, I'm like, maybe this might work. I was too afraid to try it for the first 14 years that I did these endoscopic surgeries. Then finally somebody said, Dr. Deuk, I'm going to kill myself if you don't get rid of this pain with surgery. Because he tried everything.
Yeah, I'm glad you did, because I understand that feeling.
Yes, you do. All right. You're not going to like me for the next couple of minutes, but then we'll put you to sleep, okay?
That's good.
So our patient has a herniated disc at T8-9. I'm going to draw on you for a minute, then you get to watch this later. Now, thoracic disc herniations are really hard to see on MRI, but thank God his doctor in Tennessee. Where?
St. Petersburg.
Oh, you're from St. Pete.
Yes, sir.
Why did I think you were from Tennessee?
So I have a weird twang.
Huh?
He has a weird twang.
Oh, okay. Fair enough. So have you grown up in St. Pete?
Yeah.
Oh, all right. So he's from St. Petersburg. His doctor there figured out that he had these 2 herniated discs, but they didn't know what to do about them, right?
Yeah.
All right. So this one is T8-9. This is T12-L1. And quite literally, there's no other surgeon that will ever touch these because they don't want to. They're afraid. Lay still, all right?
Okay.
We're going to put you to sleep in just 2 minutes, but I need to test something real quick. Is that where you get your pain?
Yeah.
Is that your typical pain?
Yes, sir.
How bad was it on a scale of 1 to 10?
9.
That's the highest it went?
Yeah.
So we got a 9 out of 10. And it's his typical pain, so it's concordant. And that was the T8-9. I'm sorry about that.
Oh, well.
The good news is we found one of your bad discs.
Good.
Do you know you have blue blood? I'm kidding. It's my dye. Deuk spine dye. Is that where you typically get your pain?
Yeah.
How bad is that on a scale of 1 to 10?
8,
9?
8 to 9.
Yeah, we'll just got to pick a number, 9 over 10. Concordant. All right, I got good news for you. We verified those 2 discs are the cause of your back pain. When you wake up, that pain will be gone.
Sounds good.
I want you to count from 1 to 100 for me out loud, starting with 1. You see it? Keep going. What are we starting with, Luis?
Huh?
What are we starting with?
Where?
Which one?
This one, that one.
You're okay. I barely touched the needle. It's hurting him. So those 2 discs are so sensitive. Shot. All right, let's go ahead and move down to this one, 12-1. Just keep counting. You're doing great. I want you to keep counting. Shot. You know, Luis, I'm thinking 12-1. Do we want to do... I think we want to do lumbar. Lay still. The lumbar scope.
Do you want to do this one?
I want to... I think I want to do this with a lumbar scope.
The lumbar scope? Okay. Can I have, yeah.
And your rhizotomy scope that you have, the short one, is that any the same diameter as the lumbar?
It's the same one, but it's not ready.
It's what?
It's not ready. It's
Oh, right,
yeah.
okay. Yeah. But you are going to have it ready tomorrow or no?
You don't need it tomorrow. You want it tomorrow?
Oh, I don't need it tomorrow.
I can have it ready for tomorrow.
You want me to start cervical then, at the higher one?
Yeah, this is our first.
All right. You're doing great.
Don't move, buddy.
Don't move. We're just going to get you comfortable, okay?
Oh, that number 3. I need that. Yeah, yeah. I'm sorry.
All right.
Yeah, you're right because today.
Shot. So we're going to start with the higher disc. Let's go center that. Yep. There you go. We verified that we've got the 2 painful discs. Are you okay? He's doing good. All right, I'll take the knife. We're going to make a 4mm incision for this one. These endoscopic surgeries are pretty much bloodless surgeries. We lose only a few drops of blood.
Do you would like to use the big fibers for the or no?
For the lumbar?
Yeah.
Whatever you give me. Shot. Yeah, why not? I mean, it's a lumbar scope. Might as well use the fiber. Okay, so we're starting at the upper one. Lay still. You're doing great. 4mm incision. I know the path is safe because I placed the needle while he was awake and we didn't have any problems. So now I know I can just go down the path with the dilator. Shot? That's great. You're fine. Lay still.
Doing great, buddy.
Everything's good. All right, shot. So we're close to the back of the disc at this point. You can see the bulging from the dirt. Just show them the comparison real quick on that lateral x-ray. Take the arrow and go to the disc below and show the black line. Yeah, you see the black, right? Yes, up and down there. See how flat it is, guys? That's a normal disc. That's dye in the epidural space from the discogram I did. Now go to the one above and look at how it bulges out there. Yes, yes, yes. That's a bulging disc. And that's where his pain's coming from. All right, just about done here. This is the more painful part, so. Blood pressure is good. Try to get it down a little. All right, we're right at the herniation now. That's why he's not liking it too much. Shot. All right, I need to get this in. It's going in. There's a pretty good sized tear there. You can feel it. Lay still. Let me have the mallet. Mallet. The hammer. Mallet. Impactor. Quasimodo. Make a fist. Thank you. Shot. There it is. Shot. We are inside the disc. This is a thoracic disc, T8-T9. Next, just to show you, I'm going to be doing the whole surgery through this little tube. How's he doing? So the incision is 4 millimeters, the tube is 4 millimeters wide, and I'm going to place it into the thoracic disc, transforaminal right now. As a matter of fact, I just gave a talk on this in Los Angeles at the Society for Brain Mapping and Therapeutics, and it had a lot of endoscopic surgeons from around the world there. Shot. It's a great talk. Shot. 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 That should be good. Take. Okay, we are in. Again, transforaminal because we're coming from the side at around 45 degrees. Do not use 45 degrees. It may be less, it may be more, but it has to be perfect every time.
You're ready with this, go, buddy. Let's go, man. The fiber is there.
Yeah. All right. And I know it looks like I just kind of do 45 degrees and put it in, but you have to be, you can't be too far lateral on your approach from the lateral. You want to be more medial.
Right off, please.
is the light? There we go.
Can you decrease that, please?
We need to bring the light down. It's too intense. I'm going to adjust the focus.
Yes, sir. Yes, yeah, it's okay. Yeah, it's fine, it's fine, it's fine. Yeah, it's fine. Yeah.
Okay. All right, we're on 20.
Yes. Yes, sir. Are you ready?
All right, so we're going to do this disc first.
You're welcome, man.
How's he doing? Huh? He's good. Yeah, you can see the scar tissue in the disc. Grab her. Watch that loop. Look at that disc just pushing out. You guys see that? It just squeezed out like it's almost like toothpaste under a really high pressure. Again, the reason why the nucleus squeezes out under pressure is it is under pressure. It's under pressure from inflammation. I'm going to swing this around and attack it from the other direction. So we had some interesting cases today. We started our day off with 4-level cervical Deuk laser disc repair. That went well. That patient went home. Then we did a lumbar, and the lumbar we had to abort because the patient had some breathing issues, and he's fine. But we're just going to have to reschedule him and do another procedure on another day. And then we did another lumbar. And that patient is recovering nicely right now. And now we have this thoracic lumbar as our last case. Any questions from our audience?
Yes, Doc. Diane from Facebook. How is it possible to do work and talk?
How is it possible to do work and talk? I love it.
It's like a drummer who plays and sings.
Yeah, that's exactly right. How does a musician sing and play an instrument at the same time? It takes talent, but it's doable. But I'll take that as a compliment. I think a lot of surgeons talk while they operate. Some even sing. Since I can't sing, I just talk. Yeah, that's why we do these broadcasts, Diane, so everyone can kind of see what really goes on in the operating room. Different operating rooms are a little different. Some surgeons don't talk much. They just listen to music or just think. There's more and more herniation. Look at that. And other surgeons like me, since I'm going to be talking, I might as well be teaching. That's kind of my feeling. And usually I am teaching. Surgeons talk and teach all the time. So I decided I would like to teach you, the public. You know, are you guys doing all right? And that's what I do. I teach. Yeah, this is a very painful disc. I didn't give him much dye at all, and he almost came off the table. So this is a very painful disc. There's another herniation. Long story short, Diane, a lot of surgeons do vocalize while they operate. You know, sometimes it's cursing at their staff, sometimes it's singing, and some even dance while they operate. For me, I like to just teach people. I find it to be the most productive teaching, giving people a lesson, because that's what happens in residency. You know, when we go and do our training for 7 years as a neurosurgery resident, we're actually being taught by surgeons just like me who teach while they're doing surgery. We talk and teach. So my feeling was, you know, I don't have any residents here to teach, but I sure would like to teach you what I do. So that's why we decided to broadcast years ago, so I could teach people what really happens, how it happens, why it happens, and answer your questions. You guys are my residents. Great question. Love it. Thanks for asking. All right, I'm going to pull back a little bit. I need about 5 more minutes on this disc. Then we'll go to the next one. You can help me flip. Any more great questions?
No, Doc.
You can almost see as he breathes and Valsalvas, you can actually see the herniations. They were moving in and out, but now they're mostly gone. This is all scar tissue from chronic inflammation inside the disc. I think he's going to be really feeling a whole lot better when he recovers from this surgery. See that? Inhale, exhale. Shifts the whole disc. You see that? Kind of see movement down there besides me. We call it Valsalva. See, most surgeons hide what they do in an operating room. I don't hide what I do. I want the world to see what I do. Of course, all of our patients give us permission to broadcast and record their surgery. Otherwise, you wouldn't be seeing it. So, it's not just me that wants to teach you, it's our patients as well. All right, I think this came off. There we go. So I'm pulling back a little bit. As I do, you can see more of the herniation just collapses right into the field of view. The 12 o'clock position is medial, and the 6 o'clock position is lateral in the disc. This is all abnormal. All painful tissue right here. Part of the herniation and annular tear. Great questions. Let's get some more questions from our audience. Once again, this is April 7, 2022, and we are at the Deuk Spine Institute here in Orlando, Florida, or near Orlando. We're in Melbourne. We're on the Space Coast of Florida. Space Coast is where all those satellites are launched from Elon Musk. Tomorrow at noon. Huh? Tomorrow at noon is a launch, I'm being told. So if you want to watch the launch, feel free. But this is where all the satellites launch. This is where NASA used to launch the space shuttle. As a matter of fact, those of you who don't know, I used to be on the team for launching the space shuttle. The medical team, that is. We would be on standby, ready to take care of the astronauts if something blew up or gas leaked. We had a whole team of surgeon, anesthesiologist, emergency room doctor, ER, emergency room doctor. So we used to have good times hanging out with the medical teams and on base, watching the space shuttle launch, land. I've got some great photos over the years. back in the 90s of the shuttle. No. Just about done here. Yeah, this is the more stimulating part, doctor. That's why he's feeling it a little more, I'm sure. Want me to stop?
Yeah. Fix your mask, buddy. Hold on. You're doing great. We're almost done, okay? You're doing all right. You want this book tomorrow? The small one's that mask.
If I need it.
Just, you need it?
If I need it, I may need
Okay,
it.
just in case. Okay.
Yeah. I don't need the small one. I could use a bigger one. Let me know when you're ready, doctor. Any questions from the audience?
No, Doc.
Not happy about that. Feel that. He's got a little hematoma from, if we can get the blood pressure down a little bit, be great. Quite a herniation here. All of this is inflammatory scar tissue right here. All of it. Did he say how long he's had this pain? Couple of years. Getting close to being done. There should be the end of the disc right there. Yeah, turn around. That's pretty much it. Flip it. All right, we are pretty much done here at T8-9. May want to get a little bit more here, and that's it. There's something, I don't know if it's on the camera. You see it, Luis? Like right in the middle there? Like an artifact?
Yeah, I see, I can see it.
It's starting to bug me. Alright, good. Done. Alright, let's get this out. Shut off the irrigation. I'll let you play with the scope. Let me have the dilator. Let me have the antiseptic. Water, irrigation. We always use a little antiseptic. Not that we expect there to be an infection otherwise, but we just want to watch your needles. We want to make sure that, God forbid, anything did get down there, it doesn't survive. All right, we need a roller. You just hand it to me.
Okay.
That's not where it goes. All right.
Doc, got a question from
Yes,
YouTube, white
sure.
side.
Is it falling down? It's falling down. Let go of it. We need a new irrigation. Yeah, extension tube. Don't touch anything. What is the question?
How do you work around scar tissue already in situ? Do you pull it out alongside the herniation, or do you work around it?
I think I understood the question is how do you deal with scar tissue, right?
Correct.
So the laser it literally breaks the scar tissue up, gets rid of it. Scar tissue is really tough, really dense, but the laser just basically blasts it into little pieces and it comes out. So we get rid of it with the laser. Whoa. I don't know if that answers the question, but the thing is I know where the nerves are and I stay away from them. And I just clean up everything around the nerves with the laser, and I can see the nerves with the scope, or I can see where the nerve should be. You know, I know where the nerves are. And so I can see all the anatomy in there with the scope. I know how to avoid injuring anything. And we just clean the scar tissue up around the nerves. It's easy to do. That's it right there?
Yes, that is current show.
All right, so I'm gonna go in and take this. We need to make an incision. Luis, a little pressure there. Now for this disc, we're going to use our lumbar scope, which is a better visibility. It's a little bigger scope.
You have the right there. Yeah. Sorry, what? No, it's good.
How's our blood pressure? Good?
Can I have
Keep it coming down.
The different one, can I have for the lumbar right there? Yeah. Thank you. Thank you, buddy.
Shot? I don't know, did that answer the question they had? Shot?
Yes, Doc.
Good. I need the table down just a smidgen. Down. Good. Shot? That's better. That's a little too much. Can you drop your fluoro?
Your table coming up?
No, that's good. Shot?
Dasha, what setting do you have?
Shot? All right. So this is his second herniated disc we're working on now. Good. And this is the T12-L1.
Scope.
Shot? 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 That's good. Should be good.
Close the irrigation part.
All right.
Close it.
Everything okay? You need help? Did you say something? I think that's just a steri strip if you want to do that.
Yeah, no, so it's,
How's he doing? Shot? That should be good. Let's see. Shot? Oh, yeah. Shot? Perfect. So we're going to do the second surgery with our second type of tube. It's a bigger diameter, 7 millimeter. It allows me to, no? Okay. You see this? This goes out where the black line is. Okay, I apologize. You were right. I didn't know it was there. This tube is larger, so it accommodates a bigger scope. Bigger scope allows me to increase the quality of the image from a fiber optic to a rod lens. Rod lens scopes are generally better because you get a clearer picture. All right, let's go in and take a look. There's the disc. Grabber. Thank you. I think, I don't know, we may need this to be a little bit brighter, just a little bit. That's fine right there. Let's try that. Oh, we need the blue towel? Oh yeah, there's a piece of herniation. Good. Good. This is all degenerated nucleus. So when we see this, it's a good sign that we found a disc that's definitely under the influence of inflammation. All right, let me just improve the focus just for a moment. And laser. The usual setting, right? Yeah, see, this is nice with the bigger scope, bigger tube, because this is a bigger disc. By the way, I don't know if you're aware, but discs get bigger as you go down the spine from the neck through the thoracic and then into the lumbar. I need you to move that over more. Can't hold it where you want to hold it. You got to hold it where it helps me. Okay. Move it more north. Not towards me, more north. There you go. We need 10 minutes, we'll be done. Doctor? Huh? My name's not Roger. It's so hard to move this fiber. I need experienced hands. All right, let me have the grabber. You guys got to get the herniation out of the mouth. There's a way to do that. You got to push the fabric of that thing into the mouth. It's not a pull, it's a push in and pull out. Take that. Good job. I'd say 8 minutes. Maybe 10 minutes. I think he has a pretty large central disc herniation. Is Crystal here?
yes.
How's our last patient, Crystal? Yeah, see if he got some Toradol.
Yeah.
What do you think, Berndes? You g-
Tylenol takes 20 minutes. Total should kick in about 10.
do you think?
Capital max at 1 gram.
Uh-huh.
We'll get some oral
You gotta help me out. You gotta move this thing around to help me reposition it. Are you watching? Yeah, that's better.
If you come with me, it's not oral narcotics, so I'm going to give him some oral pain medicine, see if he feels better with that.
I don't know.
Like a Percocet, 10 or 5.
Luis, can you switch?
He doesn't have allergies.
I think for somehow you can get this fiber moving in the right direction. Flynn is not quite adept at that yet. I mean, I'm asking, do you think there's something more on board that we need to know about? In other words, his response to the propofol
Okay, buddy.
was not what we expected, right?
Okay.
So you understand what I'm asking? Lay still.
I consider him pretty reliable.
Who? What?
I consider him reliable.
Reliable. All right, there's the tear right there that's causing all the pain.
Okay, keep your arm straight, buddy. Crystal. Okay, stay still, my friend. You're doing great.
Hey, Rita.
Still, got him up, dressed in a chair with his back brace on. He's still uncomfortable, wanted to go back, he's lying down. However, he's really still uncomfortable. Okay, Chip.
Almost done here, buddy.
Did he get the Toradol? How much? Is that the normal dose of Toradol?
Yes. I don't use above 30.
Huh?
I don't use above 30. You can go as high as 60, but I don't recommend that.
You what?
I don't recommend going higher than 30.
No, let's stick to 30. Why don't you call Demola? Have him come in and see him. Chet, any questions?
Yes, Doc, I was just going to say, Roland from YouTube, is it possible to fuse level L1, L2 after a complete disc tear?
Is it possible to fuse L1 and L2 after a complete disc tear?
Yes.
I mean, I'm not sure I understand the question, but you can definitely fuse L1 too. I'm not sure why you'd want to do that, but yes, you can fuse L1 too. Do they have a follow-up question?
No.
We have 5 minutes here or 10 minutes?
Yeah, about 5 minutes. Why? Huh?
No, just debating whether or not to do more protocol or something.
Got a question from Tony from Facebook.
Sure.
After 11 successful rhizotomies on my L5S1 area, United Health denied the one I need now, leaving me in a lot of pain. Do you think I would benefit by having you go in and cut the nerve out at the facet?
Yeah, great question, Tony. Thanks for asking. You're right. The key here is to figure out where the pain's coming from and then treat it. So if you've had successful rhizotomies before and you think it's exactly the same pain, then I think it's worth doing. And yes, we do rhizotomies as well, but we use different technology. We do endoscopic laser rhizotomies, and we do also what are going to be called plasma rhizotomies, where we use higher energy than a radio frequency probe. Problem with radio frequency probes is that they just don't have enough power to really deaden the pain nerve permanently. That's why people's pain keeps coming back over and over again, and they got to get it done over and over again. I don't know. I almost feel like it's done on purpose because it's pretty obvious you just need more power. The other way to get rid of facet pain is to do a fusion. It really works quite well. If I did a fusion on you, I could get rid of your facets and get rid of your facet pain permanently. So I think there are some good options for you. The first thing I would do is confirm your pain's coming from your facet joint. If it is, then I would do a plasma rhizotomy or a laser rhizotomy. All right, I think this is good. I think this is really good. You can see how arthritic this area is. Get a little more lateral here, and we're done. 3 minutes is what I expect. So we can help you at Deuk Spine, but I don't know where you live. All these people travel to come here. It's worth it. If your pain is coming from a disc, then we would recommend this procedure here, the Deuk laser disc repair. If your pain is coming from the facets, we would recommend a plasma rhizotomy. Laser standby. Just going to reach in there and see if there's any other pieces. Blood pressure is good.
Check it one more time.
Doc, not a question, but a comment I have.
Yeah.
Someone is going to wake up and be very happy. Dr. Deuk and his team are the best in the world. I am extremely thankful for all of you.
Oh, great. Who was that?
Liz from
oh.
Facebook.
Liz. Oh, Liz. So nice to hear from you. I'm glad you're doing well. That's awesome. Yeah. Great to hear from you. Liz from Texas. All right, just about done. Sorry for the blurry vision, but that's just a little bit of oozing of blood. Remember, this is an inflammatory disease, so there's going to be a lot of inflammatory tissue. Inflammatory tissue is vascular, so you are going to get bleeding. One minute. What is that? Just want to make sure I get enough of that herniation off the roof there. Oh yeah, that's a good one. I'm happy with that. We're good.
All right, lights off, please.
Scope off.
Off, please. Thank you.
Good job, everyone.
Maybe the syringe like he dad, you put the made it out, you can put a little logo on there when you first started. Just thinking.
But you, yeah. All right, let's try it. Let's try it. I want to try it. I just don't want to try it late in the day like this. Let's try it in the beginning of the day.
Yeah, because if they have a little bit of numbness, the nerve distribution will wear off in about an hour.
Exactly. That's a great idea. All right. So, done. Great job, everybody. Good job. Luis is so funny. No, he gave me his hand and I shook it. I thought Luis was congratulating me on a job well done. Don't move.
You're almost done here, buddy.
You are done.
Put your head down.
Lay still.
We're just putting some bandages on, no pressure, all right?
Any more questions, Chet?
Yeah, we have some more here and here. Yeah.
Chet,
Yes.
there is another question?
Yes.
All right, ask away and then let's wrap it up and you can get out of here. I know you've been here all day.
Thank you, Doc. How does he know when he gets all of it when there is still blue showing?
Great question. Just years and years of doing this. I know where the problematic herniation is, where it's located. It's within the annular tear. I was able to clean up the tear all the way to the back, right where the dura is. I could see the last fibers of the posterior ligament, and I knew I was at the roof. And so, and then I go top to bottom, you know, end plate to end plate, and I look laterally at 6 o'clock. So it's really just about getting that zone, cleaning it out, and then you know you got a good result. Any other questions?
No, Doc.
Hope you enjoyed the surgery. We'll see you all in a couple of weeks when I get back into the operating room. EBL 5 mil.
Are you breakfasting tomorrow?
Am I what?